Hi, this is Serge Mudipanu, an anesthesiologist from the Democratic Republic of the Congo. I've been trained in Uganda. I'll be doing the masterclass of Lifebox and presenting to you the mapping of anesthesia in the Democratic Republic of Congo, known also as DRC. So, DRC is a country located in the heart of Africa. That's in the Central Africa. And it has a population of 90 million, and the capital city itself, Kinshasa, has about 11 million of the population. That's bigger than many countries like Botswana or Namibia or Sweden even. And the infant mortality in that country is of 69 per 1,000 births, which is really big considering the size of the country. So the anesthesia situation of the country is quite terrible, if I can say so. We realize that we have only one institution training physician anesthetists, which is in the University of Kinshasa. And apart of that, we have around 6 institutions training nurse anesthetists for a program of either 3 years or 5 years, and which makes it a total of 40 physician anesthetists worldwide versus 729 non-physician anesthetists in the country. And that gives us very weak proportions to see that in Congo you have 0.04 anesthesiologists per 100,000 of population, or 1/225,000 of the population, which is very weak considering the charge of the country. And look at this map, you realize that the parts in the red side has no access to physician anesthetists, and they only have access to non-physician anesthetists, and which are even very less in number. We realize that more than 75% of the country has no access to physician anesthetists, or it has access to non-physician anesthetists, less than 5 for an entire provinces. And you realize that our provinces are huge. You will find provinces which goes for more than 100,000 kilometers per square. And you see only in central Congo and in Lualaba and sometimes in Ituri and Chopo, that's where you can get more nurse anesthetists. And going further, it's maybe only in Kinshasa where most of the 40 physician anesthetists are concentrated. But you also realize that some will also be found in the south, in Lubumbashi, and in south and north Kivu. 45 or 47 million of the population in Congo have no access to self-anesthesia. And that's because they don't have access not only to physician anesthetists, but also to nurse anesthetists. So there are some places where you won't even find a nurse anesthetist. And it is very terrible because there are not even data right now collected to find the load of mortality due to anesthesia in those areas, which is really a pity to find that it's only 28 million of the population in DRC which has access to physician anesthetists. The rest can manage to have access to nurse anesthetists, which is really a challenge in the country as big as the DRC. So, and realize that there's a huge gap in the anesthesia practice. Why do we have this gap? Is it because of the quality of training? Even for those people who are trained, the quality of training is not at the standard level of anesthesia. The practice is still questionable. And you realize that the curriculum is not set at standard level, and there's not enough faculty the material, the equipment to use are not available. And as I said before, more than 40 million of the population have no access to safe anesthesia. And you realize that for the 40 anesthesiologists which are in the country, most of them, like 80%, are concentrated in Kinshasa, which is the capital city. And the rest, 20%, are concentrated also in some rare places. And you will see that most of them, most of the other parts of the country have no access to anesthesiologists. Like when you consider the Great Kasai, when you consider the Equatorial Province and the Bandundu combined together, this is the Great Kasai, the Bandundu and the Equatorial, all of them combined together have no access at all to physician anesthetists. And those who can afford those anesthetists, they have them at a ratio of less than 5 nurse anesthetists per province, which is really terrible. As a conclusion, we are here to advocate for the training institution, because pleading for material or other item will not help much. We have to build the workforce. We have to have people to come and to train anesthesiologists and nurse anesthetists to build up the workforce of anesthesia in the DRC. And we have to have an updated anesthesia curriculum at international standard for the country, and also the equal redistribution of provider throughout the country, and that's by giving salaries, like paying people at a normal rate, and promoting anesthesia all over the country. After having so, I'm really thanking all of you for following it, and thank you.
Thank you.